I'm the National Clinical Director for NHSX, and I'm also a consultant in intensive care medicine and anaesthesia in Salford, Greater Manchester. It's a pleasure to be with you this evening. What I would like to do is briefly run through some of the programmes which NHSX has been leading as part of our COVID response. I will take a specific focus in the limited time available on those programmes which have a direct impact upon frontline clinical care. It's really important to acknowledge that we've seen a tremendous collaborative effort during the pandemic across numerous stakeholders. So the programmes which I will outline to you have been delivered with partnership working across numerous stakeholders, including NHSE, ID and X. As I've said before, this is just a very brief snapshot of the programmes which we've delivered to date. I'd also like to acknowledge the contribution of Emma Doyle. She's Head of Strategy at NHSX. So not only has she led in terms of our work plan, but also she has pulled together many of the slides which I will share with you this evening. The use of collaborative working has seen delivery of programmes at an unprecedented pace. This timeline runs from the end of January through to the middle of May, and you will see that I have annotated it with a few key delivery milestones. These milestones refer to citizen-facing services, such as the 111 COVID pathway, services which have transformed the way clinicians work, such as video consultation capability or a new telecoms deal, fundamental infrastructure changes, such as the delivery of laptops or the development of connectivity for care homes, and finally the development of new standards such as MPEX testing or simplified information governance advice. And what we see is that these services in combination add up to produce a significant impact upon the delivery of frontline services. It will be essential that at the end of the pandemic we are able to reflect on how and why we have been able to deliver such change at such an unprecedented pace. As I said earlier, I will focus upon those programmes which have had a direct impact upon frontline care. This has been delivered by the NHSX Clinical Cell working in partnership with NHSE, ID and various CSUs. The programme is demonstrated here and I will pull out a few key headlines. As you'll be aware, video consultation is now available in the vast majority of primary and secondary care organisations and is transforming care both in COVID but also for the post-COVID world. Within online direct services, we now have a specialised 111 queue such that COVID patients can be triaged via this service and if necessary be referred onwards to a team of over 1,700 GPs and other clinicians for a direct one-to-one assessment. This work has been supported by the delivery of over 24,000 laptops and other technologies by Tim Donohoe and his team in NHSX. Within citizen-facing services, we now have over 1.45 million NHS login accounts such that citizens can access services such as NHS at home. We also have a range of interactive text messages to support patients with COVID self-managing at home such that they can report their symptoms and if necessary refer back into the service. Digitally enhanced services covers a range of technologies. I will highlight two here. The first one to say is we now have the electronic prescription service live in non-primary care environments. This also enables patients to nominate their specific pharmacy such that they can collect medications from a different provider as compared to their normal pharmacy. In addition, within digitally enhanced services, we now have additional information, for example, care plans available through the summary care record. We know that this is now available in around 38% of patients, but this does require more work and communication to increase this. And finally, within the clinical cell, we have built a clinical advisory group. It's absolutely essential that any technology delivery is done with the patient at the centre of our activities, and this is where the clinical advisory group can guide us to the best use of technology in any particular scenario. So the previous slide summarised some of the achievements of the COVID-19 clinical cell within NHSX. These are of course only some of the work streams. Other work streams are referenced here on this slide. I won't go through them in detail other than to draw your attention to the third point on the slide, which is remote monitoring. So NHSX have been working with North West London CCG and also West Herts Foundation Trust to understand how pulse oximetry and a digital platform can be used in the community via a virtual ward environment. Anecdotally, this has been beneficial for both patients and the delivery of the new service models, and I'm sure that these remote monitoring technologies will be applied much more widely in future, not only for COVID patients, but also for other long-term conditions. So in summary, we've seen technology delivered at a pace which was previously considered unimaginable. This has been done via an absolute focus upon the needs of patients, citizens, and the frontline service, and working very closely alongside other key stakeholders. It is essential that we are able to replicate these models of delivery for other technology deployments following the COVID pandemic. So I would now like to move on and showcase 5 of the NHSX TechForce 19 winners. This was a technology challenge with a specific focus upon vulnerable, elderly, and self-isolating patients. The themes within this challenge were remote social care, optimizing staffing in care and the volunteering sectors, and mental health services. Thank you.